Here with Dr. Nario. Once again, Dr. Nario is at Biointegrative Health Center in Reno, Nevada. They have all kinds of different treatments, treat all kinds of different things. People come from all over the place. I've met a lot of people when I'm in the clinic from different states, even different countries. So, Biointegrative Health is, like I said, is in Reno, Nevada, and you can check them out online if you want more information. If you guys have questions for us or for the doctor, leave them in the comment section. We'd love to know what your questions are or other things that you want to know maybe about this or anything else. Put them in that comment section. If you want to reach out to me, you have questions for me, you can find out more about me, go to stevemain.com. So, welcome, Dr. Nario.
Hi, Steve. Thank you for having me again. Always a pleasure.
Okay, let's talk about what you call, what everybody calls EBOO. And it's like a blood oxidation type treatment. I don't know, maybe like a dialysis. I don't know. But I had the treatment a couple weeks ago and it seemed pretty cool. I know you've had it. So what is it? What is EBOO? What is it?
Well, Steve, this is something that I'm very excited to introduce to everybody because it's very innovative and it's so new. And we are one of the facilities here in Reno that has this machine. I think we're the only one who's using it in relation to this specific combination. And I'll show you a picture maybe right now. Let's see if that's something that everybody can. Later on, there you go. So I'm going to give you guys step-by-step description of that as we move further. Maybe we can do something later on to show you the actual machine in real time. So the thing here is, it's actually the ultimate device for detoxification and cleanup. It's almost a form of dialysis. It's like a dialysis machine, and it because why I say that is because we use a dialysis filter to clean the blood from debris of destroyed germs, heavy metals, fungus, and more, and to ozonate the blood in different stages. Essentially, as blood is drawn from a vein, it goes through a filter where it is ozonated and then reintroduced again to the body through a different vein. The difference with our machine, it adds more oxygen to the blood and does a double cleanse by doing cleaning through UV lights. And it is a closed system and where the blood is never exposed to the outside elements, and it eliminates the possibility of contamination. So again, it's double access, meaning two vein insertions.
Does it stand for anything? Does EBOO stand for anything?
Oh, that's right. I should have started with that, right? It's extracorporeal blood ozonation and oxygenation.
Yeah, okay. I don't know if it matters
Yeah,
what the words
let's just
are.
call it EBOO because
It's
everybody's
a
going to
good
forget
thing.
that.
Yeah, it's a good thing.
Right.
So, how much? Because like I did the treatment, I saw the blood come out, saw it go through this machine, and all these. It was almost like being in Willy Wonka's chocolate factory. So, how much blood comes out and is treated and then goes back in? Is it, 10 gallons? Is it a pint? How much is it? And kind of relate it. Could you relate it to like if someone was giving blood, they're going to donate blood. How does it relate to that? How much in comparison is treated?
Right. So Steve, when we talk about the blood that we involve in EBOO, okay, we always have to remember the body carries 5 to 6 liters of blood, and there are two types of session that can be done with the machine. First, for the newbies to see tolerance and how they take the treatments, we do only 1 liter of blood, and this is running for 25 minutes. If no reactions for this 25-minute sessions, then we consider now the following sessions to be longer, and there's going to be more blood that's going to be taken out, which is 2 liters. So 50 minutes of the procedure. So 25 minutes, 1 liter, 50 minutes, 2 liters. So most do well with the 2 liters from the start, especially if they did okay with the ozone UVBI that we have, which is 300 mils. And that again, you don't need to do the 25 minutes anymore. Usually, the 25 minutes are the one for the sensitive patients who are chronically ill, prone to like Herxheimer reactions. And for the normal healthy ones, like our viewers and you, these are the ones that are from the get go 2 liters, they can withstand it. But of course, by the prerequisite of using ozone UVBI first, which is the 300 mil, and they did okay. And our suggestion for the protocol is to take 3 sessions. So, meaning, as I mentioned to you, every session is 2 liters. So, 2 times 3 would be 6, meaning the whole body composition already had gone through EBOO cleansing. And they should be 1 week apart, and which normally repeats twice a year. I mean, 2 to 3 times a year if you're really perfectly fit. And for the sicker ones, we do more depending on our assessment.
Okay, so tell me what happens to the blood. What are you doing to the blood as it goes through this process?
Right. So that's definitely a good question. Again, I want to let everybody see again how the machine looks like from afar, so we can. This is probably going to be easier understood if we do it in real time. But again, right now, let me just describe everything to you. So the blood passes through first the dialysis filter. So this removes liquid waste byproducts created by the body through a combination of ultrafiltration and diffusion. So the perfect detoxifier for everyone. Next would be ozonation. While inside the filter, ozone now gets inside the blood, and a dose of almost 150,000 micrograms of ozone is introduced. And again, next one would be oxygen. So when you talk about oxygen, it simultaneously runs with ozone in 1 liter per minute. And after that, running through that filtration, there is now actually introduction of blood through UVBI, meaning the UVBI, the UV rays that goes through the machine, and UVB B and UVBA stimulates the cells, which are the red and white cells, to become more stronger, and it passes through the UVC lights, which actually will clean the blood from the microorganisms. So those are actually 4 procedures in one. That's why it's a really a package deal for everything. And again, that's definitely a bang for your buck right there. It's all in.
Yeah,
It's all in one.
that is amazing. So now I want to talk about some of the benefits, but from just what you're talking about and what I know about it, we would be here for another hour, which I don't think people want, but we would be here for another hour, I would assume, if we talked about all the details of the benefits of this machine and this treatment, because some of the things you named, okay, that's going to domino effect and benefit you, like the detoxing. Okay, it's a detox, that's a benefit. But now the domino effect of that detox in your blood, how many benefits is that going to give you? It's infinite, right?
That's correct. There's so many there's so many benefits, but again, I probably want to focus on, of course, our audience here, that are mostly the healthy viewers. This is the best detox method if you ever you're looking for one. Again, waste
Right.
products from exercise, like creatine, lactic acid, for sports injuries, it brings pain relief and tissue repair. After workouts, it increases oxygenations, and even for workouts, and also more energy because it increases ATP and the mitochondrial repair, and gives muscles enhanced performance by blood flow because it improves circulation. But for the ill, of course, it kills infections in blood. It improves the immune system through the autoimmune regulation that it does for autoimmune diseases, and also for circulation issues such as strokes and heart attacks. So many benefits all under one device.
Yeah. So you said detox. Like I do a liver cleanse as one of the IV drips that I do. But this is, you think better just as for a liver cleanse, or maybe is it just a general detox? But how would it work or compare for like a liver detox?
Right. Well, again, when you talk about liters of your blood, this is actual blood that we're cleaning out now. So when you talk about like a liver cleanse, of course, you now depend on stimulating that liver in relation to, let's say, if a liver is deceased, meaning high liver enzymes. Of course, it takes a little bit more time for the body to respond to that phosphatidylcholine. But this one, you're actually cleaning the blood where waste products are traveling. So faster effects, faster results, more if you work on the blood directly.
Wow. Okay, so uh, that I mean the detox one. Is there anything else off the top of your head that would really stick out about um, the benefits of this? The oxygen. The would it help? I mean, I'm just like I said, I'm not a doctor, but if you guys watch the channel, you know that I have stayed at a Holiday Inn Express before. Um, but would it help someone with heart disease, cardio? I mean, it just makes sense that it would at least benefit in some degree.
Right. Well, that is true, Steve. Again, there's just a few contraindications for this machine, like blood disorders, like clotting disorders. Number one, blood conditions like low G6PD, um, even like blood cancers, like with low platelets. So you can count with your fingers the contraindications of this machine, and anything under the sun will benefit from it.
Wow. Okay, well, we definitely want to talk about this more and maybe show some pictures and stuff. But one more question that I'm just curious about. What do you hear some of the patients or the clients that get this treatment? How do they feel the next 2 days, 3 days? And I know everyone's different. And I know just from my experience talking to people at the clinic, they all have a different response. But is there anything that stands out in your mind if people say, oh, I felt tired, or oh, I felt energy? Is there anything that sticks out or stands out to you about what people say maybe a week after they've gotten the treatment?
Well, Steve, the most prominent one that I really have seen, even comparing it to other IVs, is number one, pain relief. Pain relief is something that I've seen that after the session, just like a back pain or a knee pain suddenly got better that quick. That's why there's nothing that I have seen lately on how this machine kind of flipped the script in relation to results. This is one of the faster ones that I've seen ever in my career. I mean, I've been doing this for quite a while now, but this is like really a game changer for the IV therapy world.
Wow. And no, I'm glad I asked that question because I know it affects everybody differently, but that's interesting that that's kind of something that's at least a little bit common in what people are saying about it. Hey, my back pain went away or my knee pain went away. And, I'm pretty healthy. So I don't notice things like that unless I injured my back or something. What I didn't have any pain when I had the treatment done. But that's very interesting to me that pain, and that's something that they bring up. My pain went away, and you mentioned knees, backs. So, wow, very interesting. I definitely want to talk about this more. That's Dr. Nario, Biointegrative Health Center, where they do this EBOO treatment. You want to find out more about it? I'm assuming that they can call or just you have some stuff online on your website about this.
Yes, definitely, it's there, and also we're building up the materials here in the clinic also for everybody to see and for them to learn more about it.
Okay, so they can initially find out just the beginning of it by going to the website,
Mhm.
Biointegrative Health Center. So thanks for being with us, Doctor.
All right, as we again, always my pleasure, Steve, and thank you again for having me. As we all know, knowledge is power, and thank you for letting me provide you with the edge in longevity and health maintenance, which I call the biological edge or the bio edge.